Oh, join in.
We're live.
I can't sleep today. Good morning, everyone. Good morning. How's everybody doing this beautiful rainy Wednesday? I don't know about y'all, but it's raining and cloudy out here.
Pouring down rain.
It's fall.
I'd rather the rain than the snow.
Me too.
Oh, you don't like snow, Stephen?
That's
I'd rather the
no.
rain than the drought.
No,
Oh,
I
yes. That's right.
And it doesn't even feel like fall. I mean, it was 70, almost 80 degrees outside yesterday, so it doesn't feel like fall.
Well, Sunday we're supposed to go.
Yeah, and the leaves are falling, so I'm gonna let all the leaves fall before I rake. So
I really wanted to go to the mountains on the weekend, so I hope it doesn't get.
It's beautiful. All right, well let's. I guess we should start the show. Good morning, everyone. Welcome to Coffee and Dulce. I'm Christian Cano, along with Mamma Ruth, our co-host, and our other wonderful neighbors. We want to welcome you on Facebook Live, but also those who join us on Facebook later and also on YouTube. Today's conversation is Medicare versus Medicare Advantage. We want to kind of educate people on the difference between both of them. And the reason is because we're not seeing any more political ads, but we're seeing tons of Medicare Advantage ads. I don't think I've seen Joe Namath more in the last couple of weeks.
I used to like him.
He still looks good. I mean, he's still
not up close.
Okay. Yeah, that was a good one. And there's a Medicare hotline you can call. There's all kinds of free gym memberships and free massages. And I made that one up. I don't know. But there's all kinds of free stuff. We're going to talk about that. But before we do, we're going to go around our Brady Bunch screen and have everyone introduce themselves. And then also their imaginary button that gives me time to share us on our other platforms as well. So Mama Ruth, do you know who is on our social? I have to look this way.
Yeah, it's Steve, Dr. B, Barbara, and myself.
Okay, we'll start with Steve.
I'm Stephen DiFiore. I'm the recording secretary of the Libertarian Party of Mecklenburg County. A great and tremendous friend to Christian Cano. You can ask anybody. They'll say that I'm the best, that I'm lovely, that people do often compliment me. Believe me, it's completely honest. I've been told I have a good sense of humor. And off to the next one.
And that's all that matters, right? I'm George Bohmfalk. I'm a retired physician. My main button is Medicare for All, which we need so desperately. My other button is Black Lives Matter, which we also need desperately to address our national scandal, problem, fatal flaw of systemic racism. Next.
Me?
Barb.
Okay. My name is Barb Bacon. I live in South Charlotte. I am a healthcare advocate for the community. And lately I've been Black Lives Matter. We've had an incident in my family. I have a niece and a nephew that are mulatto. And for the first time, my nephew experienced a little discourse in the neighborhood, and he was told to take his you-know-what and go home. So my niece was really hysterical. And I don't know I'm staying out of it. But I guess once it impacts your family life, you pay a lot more attention to it. So that's my big deal for this week.
Good morning, everyone. My name is Ruth Perez. Everybody here calls me Mama Ruth since I'm already a granny. I am a community advocate. I love to help out there. I'm involved in different boards. And today my button, like always, of course, I support Medicare for All. I am very happy that we finally I wish Sonia will be on the show today because she said not flipping the blue, but I think we flipped the house to blue. And major theme, the most important, because I've been watching a lot of comments of very close friends of mine being so much haters, I would say, bad mouth talking, saying things. And we all come to one conclusion. We're in this world, we all should be one. My shirt says God is love. And that's all that matters. It doesn't matter if you're blue or red. We should come to an accord for a better world.
Well, thank you very much. The election is over. Yay! And we have a new.
Well, mainly it's over. Mainly it's over. There's a few
We-
little details here and there.
That's right.
There's an epilogue to be hashed out.
Mainly in Georgia. Yeah.
Well, we do have a president-elect.
Everybody's commenting about what happened with George Al Gore a few years back. So we're all in what's going to happen. But
Yeah,
now,
It isn't
we're good.
at all the same. No.
Yeah, but I agree with you, Mama Ruth. I mean, we've all got to come together, and that's actually our next show. How we come together as family and neighbors after this election.
And how to accept whatever happened. It's not our fault. We were just the voices. Okay.
Yes.
At the end, they gotta have to understand that it's for the best.
Yes.
Now everybody's complaining about, we're gonna go into a deep dish, that we're gonna be going into socialism, that you are constructing your own way for your future.
Yes.
And
Well,
with the help of the government's officials and whoever is on the seats, then we can all collaborate. But we'll talk about it in the next show.
Yes, we'll talk about the next show. But once again, I don't know if y'all remember, after when marriage equality passed, everyone said, "Oh my gosh, the world's going to come to an end." We haven't come to an end, so that's okay. So let's salute to Coffee and Pandusi. If you have your coffee, or
I'm anxious for Christmas, though.
Oh, yes. Teaching everyone. And we also always want to thank our local immigrant-owned bakery, Manolo's Bakery, our Pandusi sponsor. This is Manolo's Bakery on Central Avenue. Please visit your Black and brown small businesses in the Charlotte or wherever you are watching our show and support them during this time. I was really impressed that Dr. Fauci said that he orders takeout at least 2 or 3 times a week just to support local businesses. I was like, he's a really good guy. And anyway, we could have another long conversation.
Or he's the politician, he lied to you.
Oh, yeah.
Well, you got to learn also
He's not a politician. He's not a politician.
He's not.
Fauci is not a politician. I frankly don't even know who he might have voted for in the last 10 elections. I think he's the paragon of apolitical public health.
Another thing that we have to teach our community is to define see the difference between local business owners than franchise and, just beautiful.
Oh, yes. That's a good point. Excellent point, Mama Ruth. And there's some franchises that are locally owned. So, it is very confusing. Okay, so we're gonna try to educate people, and especially us, on the difference between Medicare and Medicare Advantage. You've been seeing, especially if you're like me, I watch Me TV and the kind of like the off channels, and it's all Medicare Advantage commercials, Medicare hotline, and open enrollment is until December 15th. Is that right, Barb?
December 7th for some plans and December 15th for anything that's considered affordable care.
Okay, so people are still making decisions on what they want to enroll in. Our household is now official members of the AARP. I am so excited. We got our cards yesterday. Hey, I was so excited, Dr. B. I've been waiting my whole life to get my discount at Harris Teeter on Thursdays.
Look, I think before I turned 50, I think I was probably still in my 40s, I started getting this crap from the AARP. And I have used the AARP discount ever since then. They don't ask. The AARP is an insurance company. It's not an association of old people. It is an insurance company in the guise of organization of old folks.
I just want my discount.
All you gotta be to use AARP.
I'm sorry?
You can become a member at 50, but you don't get your discounts, I think, until 55. I'm not sure exactly how all that works.
I got mine at about 47. So.
Oh, yeah. Okay. Yeah. All right. Okay.
Still got a long way then. Okay.
You got a long way.
So Medicare, Medicare Advantage.
Out there.
Yeah. So the reason I brought up AARP, not only to show off that I got the card, but also because AARP did an article in their magazine in September trying to explain to their members the difference between regular Medicare and Medicare Advantage, or they call it MA, in the article. And they were educating the difference. And I'll be honest with you, and I kind of mentioned with Stephen right before the show, if I didn't know anything about it, it sounded as if though, God, this Medicare Advantage is a great deal. I mean, they said some of the deductibles you don't have to pay, or, all this. So it's very confusing to people. But from a person who is supportive of Medicare for all, which is a completely different show, I'm wondering, well, how can they provide all this and all these commercials and pay Joe Namath and do all this kind of stuff? How do they make any money? I'm curious about that. So we've got Dr. B on our show. Dr. B, can you kind of explain to us, and then we also have some questions for Barbara as well, because Barbara's been very involved as a healthcare advocate, helping people enroll in plans and prescriptions and so forth. So Dr. B, can you kind of explain to us lay people, what is the difference between Medicare and Medicare Advantage?
Great. I'd love to see your AARP article, so please forward that to me, or maybe I'd kind of look it up. I'll be interested to see how they pitched it, although I can pretty well guess. So to have a little lecture, which I'll try to keep as short as possible, Medicare Advantage is one of the parts of Medicare. It's Part C. And that was created around the end of the 1900s, early 2000. And the point was that a bunch of these conservatives kind of say, we think that private business, for-profit motivated, can do a better job of controlling healthcare costs than can the stupid government with regular traditional Medicare. So how about you let private insurance companies enroll people in basically an HMO, a health maintenance organization, and we'll kind of sign people up, and the government will pay us a certain amount of dollars every month, your premium, and come hell or high water, we'll take care of these people, and we will show that we can give better results, healthier patients, better outcomes, and save the government money. So that was the idea, and everybody said, great, take off. In order to help them attract patients to this new idea, the government kind of said, we'll pay you a little bonus for each patient above and beyond kind of what the average Medicare patient cost, was. Of course, they said, fine. Then what happened is the private company started marketing. And of course, if you're going to deal with insurance for old people, your goal is to have in your insurance pool the youngest and healthiest patients who are less likely to get sick and break hips and have heart attacks and things like that. So these companies very cleverly, because American business, right? They very carefully and cleverly marketed themselves to attract these younger and healthier kind of patients. They did things, like offering these little bells and whistles, like these gym memberships. Well, we all know how many people actually show up and use a gym membership after about the first month, right? So that's really not costing these insurance companies much, but they do similar little come-ons like that to try to attract these patients. And so now, because of their success in marketing, Medicare Advantage accounts for about 1/3 of everybody in Medicare. Everybody over 65, about 1/3 of people are in these Medicare Advantage plans. And for regular Medicare, when you turn 65, you have to fill out one form and just sign up for Medicare, no questions asked. With Medicare Advantage, you have to shop, right? And everybody talks about, oh, that competition is going to be great. But it's a burden on people because they're trying to compare, well, do I go to this gym or I get this donut bonus, whatever. And so it's presented a conundrum for the retirees, because now instead of kind of having this straightforward kind of Medicare plan, they have to do a bunch of confusing shopping and figure out who's telling the truth, Joe Namath or AARP. So how has it worked out? It is a shell game. I think it's a scandal. I think it's one of the worst things that's kind of happened. And the dilemma is, it may be temporarily and on the surface good for the individual because you get a discount and you have limited out-of-pocket spending and you get a gym membership, for heaven's sake. It's terrible for the country. It's kind of like people kind of say, what's better? You're supposed to save money, but if everybody saves money and doesn't spend, well, then the economy doesn't do well. So there's a difference between what's good for the individual and what's good for the body, in general, the greater good. So here's what happens. Having successfully marketed to these younger, healthier kind of retired people, it turns out that the Medicare Advantage companies are not having to spend as much. So they've already gotten this set dollar rate from the government, so they're pocketing the difference. That's how they pay for Joe Namath. They're making a lot more money. Then they kind of this is proved, and articles for this are miles long and full of higher math and whatnot. But the bottom line is that these private insurance companies, for-profit companies, have manipulated data to make it seem like their patients in their programs are sicker and more expensive than they really are. So they've been fudging the numbers. And there's all sorts of court cases and things like that. You're having to pay back hundreds of thousands of dollars or millions of dollars as penalties for having kind of gamed the system. These things like they say, oh, you have a limited out-of-pocket spending. You and I are paying for that. I mean, those of us in the regular tax general fund and other Medicare enrollees, so everybody else in their taxes is paying this, for the limited out-of-pocket. It's not coming out of the insurance companies because they kind of figured out a little way around that. But the biggest thing is that Medicare Advantage, being an HMO, they have a limited provider network, which is all fine as long as every doctor you think you're ever going to need is going to be in there. But if you kind of have to have a heart transplant and the heart transplant team is not in your Medicare Advantage team, you pay out of pocket, or you just kind of can't get treated. So it turns out that the older, sicker people in Medicare Advantage kind of find out, well, this isn't working out too well. So they, at the period of open enrollment, leave Medicare Advantage and go back into regular Medicare. The Medicare Advantage companies love that, don't they? Because that's cutting their expenses. So they're kind of, trying to whittle down the number of higher risks that they kind of have. And so over these 20 years, it's turned out that Medicare Advantage does not lower costs. In fact, it costs the government more per each Medicare Advantage patient than it does a regular Medicare patient because of these little bonuses, and they're gaming the system. Nor have they produced any better outcomes. Their rates of heart attacks and getting over hip surgery and cancer and all that are no better whatsoever than those in regular Medicare. Their administrative expenses are about 6 to 8 times higher than traditional Medicare because they're paying Joe Namath, and they kind of have advertisements and salespeople and all this kind of administration denying claims and lawsuits and everything. So the bottom line is that those of us and those of you in Medicare Advantage plans are causing more money to be spent, although it might not be coming out of your pocket, and you get less, and the profits to the private insurance companies are growing. So you may personally benefit, but it's at the expense of everybody else. So that's the long and short of my understanding of Medicare Advantage.
So the two questions I have, and we don't have to answer them now, but these are the questions that I have after reading the article. And I gave you a link, Dr. B. I don't know if you have a chance to read it right now, but of the ARP article. The two questions that they had in their article was exactly what you said. 96% of doctors accept Medicare. So your availability to find a doctor where, if you live in the country or wherever you live, is easier with Medicare, regular Medicare. Because Medicare Advantage is a private system, you have to use the doctors in their network, so you actually have fewer doctors. It's almost the exact opposite argument that people were using against the Affordable Care Act. We want the choice of being able to use our doctor. This is actually taking that choice away from you, but you have to use the network. So if you live in a small area in North Carolina and your doctor is not that network, you may not have the option to purchase Medicare Advantage because whatever Humana may not have doctors in Lincoln County. You may have to go to Gaston County or something like that. So that was the first thing. The second question I have, and we can probably answer this later, how is this going to impact seniors if they catch COVID-19? I'm curious about, that. Is that going to make any difference on whether they get Medicare Advantage or Medicare, if that even makes a difference? But before we do that, I know that Stephen may have some questions. And Barbara, I know you have you have been really looking at like the cost of prescriptions and things like that. Is that right?
Right. Well, I got to say I agree with Dr. B on everything that he said. The one deficiency that I see in Advantage plans is, and the reason that I got involved again in this situation, is I had a neighbor that had a disorder and she was in an Advantage plan, and they were not going to cover a procedure because the physician that she was going to would not accept the reimbursement that the company was offering. So then she's got to go out of network. And then she called me and I said, this is one of the things I told you about an Advantage plan. You need to find out what happens if you get sick. And she had this disorder and I was worried for her, but she saved so much money that in the long run, she thought she was going to save, and she whacked through that money that she saved in that one procedure. We were able to find somebody to treat her, like you said, within another network and not pay as much as out of network, but it took forever. And it was like appeals and appeals and appeals. It's a pain in the butt, which is what I used to do for my job for our patients in companies. And I have no fondness for insurance companies. So, but there are certain people, like Dr. B says, the younger, healthier people that are seniors, that for a while, it makes sense if their whole goal is just to save money. Fine. They like all these other perks and whatever. I said, but the minute you have any kind of a disorder come up that's going to be long-term, or you're getting a fast shuffle, I call it, by your doctor, your primary care, you need to do something about it and make sure what your plans, how to get out of it. And sometimes you have to wait for open enrollment. And that, that happened in January, you have a whole 11 months. So, and while I was helping her, I got involved in her prescription drugs. And
so Barb, you are, not to interrupt you, but what you said was a very important question. So what people have to understand is, if you sign up for Medicare Advantage, and it starts January 1st,
right,
if you don't like it, you can't just get out and sign up for them. You got to wait until the open enrollment. You can't have an exception made or anything.
It's very, very difficult to do that, and they make it difficult to do that.
Okay.
Even though, can you get penalized, or can you get, can you get charged and just move on, or you can't?
I don't know anymore, because I kind of backed away from it. I have two friends that do this for a living. They are insurance salespeople. That's all they sell is Medicare Advantage plans, and they don't agree. So I'm like, I'm just trying to stay out of it. But I got involved with her prescription problems.
Sure.
And she's Medicare.
Well, how does that compare, Barb, with the prescriptions with Medicare Advantage and Medicare? I mean, is that an advantage? I mean, do they have I know with Medicare, they can't negotiate prescription prices.
They can't. No.
Okay. Which has changed?
George Bush's little deal put me through the ceiling, because I was still in my old job in pharmaceutical land. And I'm like, why would you do this? And then I totally stupid. We know why I did it. But
Medicare Advantage people can?
Yes. Oh. You get discounts. Their whole thing is different. Prescription drugs under regular Medicare has this wonderful thing called the donut hole. So on January 1 till you reach $4,020, you're just paying a copay. And you have a deductible this year of $435. So once you hit that $4,021, then you're in the donut hole. And then all these other things happen. And this is when you can shop. That's why I have switched a couple of my neighbors to GoodRx. You see them advertised on TV, where you download the app on your phone.
Is that Martin Sheen?
No, that's Silver. He's Silver. Oh. The Silver Fox. Yes, that's okay. But DrugRx is a little bit cheaper, and I have a preference for them because they have more pharmacies. So if you're traveling, well, nobody's traveling anymore, but I mean, say it was normal time and you went and stayed with your son or your daughter, or you went on vacation and you need a prescription, you're more likely to be able to use a GoodRx coupon at a Walgreens or a CVS, someplace, wherever you are. But that's not always true. Harris Teeter's doesn't accept some of them. I haven't done all that, but I saved each of my neighbors over $200 a month. They opt out of their drug plan D for Medicare and use their GoodRx card for certain prescriptions, and for other ones, they just use their Medicare D card.
Okay.
See, so I mean, I suppose everyone watching this is totally confused right now. They
Right,
say, what
right.
the hell? I
Well,
can't keep up with that. So why do we do this? We do this in pursuit of saving, I can save $23 a month or something like that for this torture. And that's why Medicare for All, which would cover
Exactly.
prescription drugs, and it
Yeah.
would negotiate drug prices, it would just solve all this. But everybody says, we don't want government controlling everything.
But
Okay, so go hire your own police department then.
when I was in pharmaceuticals, I was on the Medicaid task force. Medicaid negotiates drug prices. You do not go over a certain price. If you launch a new drug, you've got to go to each state and negotiate the price.
And Barbara, that's a good point you have. And this is to confuse people even more.
Right.
You could be on Medicare.
Right.
And also qualify for Medicaid.
Medicaid, yes. So they're called Medi patients.
Yes. So you could be a senior who is purchasing Medicare.
Right.
And because of your income or whatever the case or your need,
right.
You could actually get help by also having Medicaid.
Right. And their prescription drug plan is better than what you get from Medicaid because of Medicare because
it's for poor people.
So, exactly.
Mm-hmm.
Or some disabled people that don't fall through the holes of Medicare disability. So yes, but you're right, Dr. B. The whole thing is if it was just, well, let's look at COVID in the other countries. Everybody's getting treated. Everybody gets the same drugs because it's in one place. It's single payer. Yeah. And that's where we need. That's where we need to go.
And we are going to have a show dedicated completely to Medicare for All. We've been promising Stephen that show for a long time, and we promise. But I can see Stephen's face, and I know he has questions. Stephen, give us your questions.
So yeah, I do have a couple questions. So George, Barb, you're talking about all these different rules and these weird hoops that you have to jump through. Who makes the rules that you have to jump through these hoops? Or is this from the legislature? Is this Congress passing laws that then
Medicare?
Okay, I sense that you're kind of wanting to throw this on the politicians and say it's all
that's so there's in everything that we in these complex systems, right? And healthcare is a complex system. There are processes by which things happen, and then there are things we can do to maybe affect change or make things better, or try to talk about understanding. So either these processes in part start, let's say, at the because I know, like for example, the HMO Act of 1973 started a lot of this stuff, right? We didn't have almost any of these problems before that act, and then a lot of things snowballed from there. Whether it was, let's try to fix this problem, or hey, we got this. And I know sometimes Congress will pass a law that doesn't really have a lot of details in it, and so they leave it up to, let's say, an executive administration or department or even the industry itself to self-regulate, and they just kind of oversee and like, it's good enough, right? So my question is, all these additional rules and hoops and these things that were like, this is kind of silly, why is this so hard? Who's making those rules, either completely or in part? Is it just the fact that the insurance companies themselves, like, we want to do this because whatever reason they have, or we're constrained by state laws, or there's some federal mandate that says we have to do this? Like, where are those coming from?
Yeah, I think it's all of the above. And in the case of the HMO Act, that seemed like a reasonable idea. Let's kind of give it a whirl. And so, of course, private industry was behind that, and the private insurance company lobbies probably wrote a whole lot of that. In the case of the prescription drug plan, as Barbara intimated, back in 2003, when they decided to come up with a prescription drug plan, though the pharmaceutical lobbies kind of forced Congress into a deal. They said, we're going to fight this tooth and nail unless you put a provision in there that Medicare cannot negotiate drug prices. And so the congressmen scratch their head and say, well, we can either have that or we can have nothing, because they're going to fight us so hard. And so Congress rolled over right?
Well, they all keep
And
money.
and so because of the drug companies' manipulation, we have this provision that Medicare cannot negotiate drug prices. So some of this is private industry writing the bills and the regulations, as you say, and some of it's, politicians try to do the right thing. It's all of the above, but it's just ended up with this morass of complexity that can all just be so simplified with a single payer system.
In addition, you've got Medicare that's the boss, because even these Advantage plans, they sign a contract with Medicare and they must follow the Medicare guidelines or they can't say Medicare Advantage. And Medicare does a good job of policing that. But then once you get into how you administer each of those separate plans, it's the big corporate boss that dictates what happens. But think how many plans there are. Think how many different insurance companies are offering Advantage plans. To make it even more complicated, if you're a Medicare patient that has Medicare and Medicaid, Medicaid used to be 50-50, 50 government funded, 50 state funded. Now what is it? 70-30 state funded, 30% Fed. So only 30% of the money is controlled and the states have all the other control, which is why all these governors, it's just like wham. And now you want to know why I retired? Oh,
wait, so it used to be 50-50 states and feds, and now it's mostly on the states now?
Yes.
No. It's mostly on the Fed. Medicaid is mostly on the states, and in fact, with the Affordable Care Act, but my understanding is the provision was to try to get more states to expand Medicaid. There was a provision that I think for some finite time period that the federal government would assume 90% of the cost.
Right.
And so, it's a overwhelmingly federal program, but the states all have a little skin in the game. And so it's only states with Republican governors or legislatures like North Carolina that have not yet expanded Medicaid. They're becoming it's kind of a scandal.
So I guess, Stephen, I don't know if you have another question, but I have a question.
No, I mean, my main question was, there are all these weird rules and hurdles and hoops. And, my question is, where are those being generated from? Because I think,
everywhere.
Okay. So it's a systemic problem.
Well, in my opinion, the boss is Medicare for most of this, or HHS. So government.
So Mama Ruth, I don't know if you have any questions, or I know you're, but I'm listening to this. And I'm thinking of some Meemaw who is watching the commercials after Little House on the Prairie or Andy Griffin show, and you see the Joe Namath commercial. And then the one that says, do you think this is confusing? Call the Medicare hotline and we will help you. And this, it's already confusing because they don't even know how to program their VCR if they still have a VCR. Yep. They don't know how to use their cell phones. They don't have. So what they're going to do is they're going to ask their kids or their grandkids, Mijo, can you help me explain this to me so I can do, this. And I'm thinking of hearing all of this and being confused as heck. This is incredibly complicated and confusing. And I can see how those commercials work, because when it is so confusing and you have someone on the commercial selling you something, it's just easier to just go, oh, let's just do the Joe Namath one. Or
I do that myself with my mother.
Joe Namath doesn't sell a particular plan. He has them call an 800 number, and then it's a vulture land of all these different companies. So he's just the shill because of his name. And Art called. He said, I called the hotline because he likes Joe Namath. He goes, holy God, I said, I told you not to call.
It's like calling a telemarketing call center, and then they're going to sell you one of 6 or 7 insurance companies. And I'm thinking of what most people would think, like I'm purchasing my insurance for next year on the marketplace. I'm purchasing from there. And I'm looking at that, and there's certain things I'm looking at, like what's the premium, what's the deductible, how much, So I'm thinking of someone, a senior, calling and telling the person, the operator, just give me whatever I need, with less than $30 a month I have to pay, or $50 a month. You know what I mean? Well, we've got a really good deal for you. This one is only $22, but for $10 more, you can get a gym membership and, you know, and do you smoke? I'm thinking it sounds like a racket. I mean,
It's I mean, I know Stephen
Well,
is
it
all big on
literally is,
capitalism,
but
and I
yeah.
think most of us here are all for capitalism, but capitalism can run amok sometimes. And I think healthcare is a perfect example of capitalism run amok.
We call that
much like when-
cronyism.
whatever, much like capitalism ran amok in the Roman Republic when they had for-profit fire departments, and that just kind of didn't work out too well.
And what happened to
So,
that?
yeah.
But you know, and so I'm glad that we're able to kind of talk about this, because if we, and we're all pretty involved in trying to educate ourselves, whether it was Medicare Advantage or Stephen is more about reducing the obstacles for, let me make sure
Obstacles for care. Yeah.
Yeah, that's right. I mean, Stephen's about,
for example, like
Yeah.
why would you want one healthcare plan over another, right? Other than the fact that you have a rate or what's covered. My understanding, and please correct me if I'm wrong, if any of you know this, different insurance companies negotiate different prices for the same procedure, right? So if you're with insurance company A and you go to the hospital for a knee replacement, you'll pay a different price than insurance company B for that same procedure at the same hospital with the same doctors.
Correct.
Now, to me, that just seems completely ridiculous. Why in God's name is the same thing cost
Can we all go
different
through
rate?
this one?
And it's like that with almost every other like pretty much every single medical procedure there is that I know of have these negotiated rates on the back end that the customer, the patient, is completely removed from.
Yeah, you can't
And
find
so,
out half the time.
yeah, there's no way for you to know what something costs. It's like it's as ridiculous, and again, this is my viewpoint. It's as ridiculous as going into a shop to buy a suit. The guy, the tailor says, "I'm going to get you a perfect suit, put it on you. Man, you look good. Have a good day." It's like, "Well, how much is? Don't worry about it. It's yours. We'll just send you a bill when you get home." No one would buy into that. Like, that's completely ridiculous. But yet we do that with healthcare all the time.
Dr. B.
Because the average patient is not buying the product; he's buying an insurance policy, which is at this higher level. And even if we had price transparency, I have a lot of friends in the industry who say the solution to all this is price transparency. That would restore a fair and balanced playing field to capitalism and competition and all that. And wouldn't it be great?
Or at least not getting ripped off.
But transparency is never going to work, because I mean, that same insurance company that, let's say, will pay $10,000 for a knee operation, might pay for a shoulder operation higher or lower amount. So it's not like it's consistent. It's just a complete grab bag. It's just a scandal. It's an embarrassment. It can't go on much longer. And we need to
It's kind of like volume discounts, you guys. I mean, I got two friends that are surgeons, and they're like, we have to say no to some people because we know we're not going to get as much money. And I'm like, money? And when I started in the pharmaceutical industry, we cared about taking care of patients. Now it's all about the damn money, and it makes me so mad. That's why
it's really expensive to
capitalism,
become
free
a doctor.
enterprise.
So.
That's
God
that rules us.
So one of the things that I am hearing, and of course, this is going to set us up for a great Medicare for All show, because these are all the questions that everyone has about private insurance companies. It's like healthcare is one of those, our medical help to get medical to go to the doctor. It's one of the few industries, which I hate to call it an industry, that paying cash is not the smartest thing. So if you went to a doctor and said, I need a knee surgery, but I got cash, you're going to pay the highest price because nothing's been negotiated. So, there are a lot of maybe older people who grew up in a time where if you pay cash for the car, you actually save, some money or whatever. It doesn't work like that in a lot of things, because if you say you pay, you're paying the most premium price.
And in North Carolina, there are laws that actually prevent some physicians, like who run, like, say, an independent clinic, from even being able to offer a cash-based price plan. There was that gastroenterologist in Greensboro who was
Mm-hmm.
prevented from buying the equipment that he needed to offer, cheap services, MRIs, CAT scans, things like that. The government said you're not allowed to buy those things. Sorry,
Mm-hmm.
they already have them at the hospital. And so he was like, well, I can't do it. Same thing with an ophthalmologist out in Kinston. He's prevented from upgrading his office to qualify for eye surgery center stuff. Even though he's a qualified surgeon, he does surgeries at the hospital, paying the hospital rate.
Yep.
He needs a special certificate from the state in order to perform those surgeries to remove cataracts, for example, in his office at a much cheaper rate because he doesn't have to pay the hospital overhead costs. And the state says, no, you're not allowed to do it.
So it sounds like now we know what Stephen's argument is going to be during the Medicare for All show that we have. So so when we get to that show, know where Stephen's coming from.
Well, yeah. But I mean, but one of the interesting things about the ophthalmologist in particular, actually, was he never thought about it because most of his patients were getting their care through Medicaid and Medicare, right? And that's a subsidy. And again, there's advantages and disadvantages to that. But most of these people coming in, they didn't really have to think about the cost until a young guy came in, right, my age, with a cataract. And if anyone knows what insurance is like for people my age right now, apparently eyes are not like a thing required for life. There's nothing that covers eye care. When I had a vitreous tear, is like basically like, there was no insurance company covers that. It's like, well, darn it, man, I kind of need my vitreous to be in good condition so I can see right. And it's like, nope, sorry, that's who cares about you. And so when this kid came in, he goes, hey, I need to have this cataract removed. He's like, well, we can go to the hospital. It's like, I don't have the money for that. It's like, well, what about the insurance company? I have VSP, which gives me glasses, but doesn't do eye surgeries or anything like that. He goes, well, okay, well, it'll cost $20,000 for me to remove your cataract. He goes, I don't have $20,000. And, most people go, wait a minute, doesn't Doctors Without Borders do cataract removals in third world countries for much cheaper than $20,000? Why is it $20,000 in North Carolina? And he's like, and this ophthalmologist is like, he started asking these questions, like, why is that the case? And there's no one. I don't think there's any one solution. It's a huge mess.
Yes, there is. There is one solution.
More government involvement.
I disagree. Medicare for all. Medicare for all. Medicare for all.
Well, that was the question. I mean, as I'm listening to these commercials, and everyone knows I've been supportive of Medicare for all for probably 4 years, since Tara Long brought me into the conversation and going to the meetings and trying to educate myself on the cost savings that it would save taxpayers, that it would save us if we went to a more efficient type of system. And as I have been trying to educate myself, and I listen to what Stephen has, Jeff Scott, we've had conversations, and I understand what they're saying, but they still can't give me other than theories, other than trickle down these theories. They have never said, look at this country, look at this, whatever, this is how they're doing it and it's working. They can't. They always tell me, if we did it this way, it could happen. But with Medicare for All, we can actually look at other organizations or groups, and we can see that it's working. And so, but when I'm
like
listening
to
these,
the VA is super awesome, right?
Oh, don't get started on the VA.
Everybody loves to slam the post office and the VA, but the VA actually has better outcomes for matched demographic groups than the private healthcare delivery system. You may kind of not like a lot of things about the VA, but don't say that they don't deliver the quality.
Well, George, Dr. B, I have 4 cases currently where can't get a new doctor assigned to him, waiting for his drugs to show up in the mail. I'm
not saying it's perfect. I'm not saying it's perfect. And you can find anecdotes of things like that. But when you kind of say, what does it cost and what are the outcomes?
Fix it, it's like it's not fixed. Maybe they have better outcomes, but the treatment regimen time is triple what we are used to, and that's a fact. And
Sure.
it's broken, but maybe they have, I don't know. I'm not a fan.
So,
I mean, I take Blue Cross Blue Shield over TRICARE for Life any day,
yeah.
personally.
Oh, yeah, I'm a real fond of them too. Yeah, okay.
So as I have been attending these meetings, the Medicare for All meetings and educating myself, and I understand that the proposals that are out there are to combine with eye, dental, ear as well. And when I've heard these, and then I've heard people who are against Medicare for All, they're not really giving you another option. They're just saying, I'm against this. How are we going to pay for eye care? How are we going to pay for dental care? How are we going to pay for ear pieces? How are we going to pay? And that has been their whole argument since I have been following this. And then I see the Medicare Advantage commercials that say, and we give you eye care, and we give you dental care, and we give you ear piece. They're proving the case. Plus, they have all this overhead. They're actually saying exactly what the people who are against Medicare for, and these are private insurance companies that are proving the case for Medicare for All. So I don't even know if they're unsuspectively proving. So when we get to this country gets to the Medicare for All debate, because we've been debating it, but not really, is it really going to pass? All we have to do is play the commercials from the private insurance companies, and what they're saying is almost exactly what the people for Medicare for All are saying. They're saying, we can give you eye care, and we can give you gym memberships. So so for me, yeah.
What I've learned,
They're paying for those other benefits
Okay.
by not paying for the standard
Okay.
benefits, or paying it at a much lower reimbursement rate where people really aren't getting that benefit. And that's the downside to Advantage plans. So, and I bet if they started using that analogy, you'd see an explosion of people saying, wait a minute, they're terrible.
Yeah.
So,
Okay.
I mean, it could invoke great debate, which is what we need.
And like I said, the main way that Medicare Advantage plans can do all those things that you just mentioned and prove this case is because they're selecting a healthy, younger risk pool. So therefore, they don't want, old, burned out kind of old people. They shift those back onto the government. And it's totally by market manipulation.
Sure. Mama Ruth?
what I've learned, I don't carry insurance, so I'm a self-pay. And I've learned throughout my years with my big family is to have a extra bucket. And just like the way people pay for their monthly or weekly insurance, I've been putting all that money in there. Every time we have an emergency or something and I have to go get a teeth pull out or get an eye exam, whatever, I'd rather pay it out of my pocket, which I've learned that some of the physicians, some of those doctors will give you an extra big discount when you're self-pay.
Yeah, well, that's all good, Mama Ruth, and that's the whole appeal behind these health savings accounts that people talk about, and that's all well and good. It's just like Medicare Advantage is all well and good as long as you don't get big sick. But if you suddenly need a kidney transplant, you're screwed. That bucket that you've been putting a little money in, the average family in the United States has cannot handle a $400 financial emergency.
Yeah.
If their car gets broken, that's why it sits out in the front yard on blocks. If whatever. But if with healthcare, you kind of can't just put it out in the yard on blocks, and the average family cannot self-pay like that. It's just wishful thinking.
Yeah, we need something to be able to level up and be all in the same. Like, let's say, okay, this is like a flat rate. This is going to be it, and that's it.
Medicare. Okay. Well, I know we're not supposed to talk about that. I told Stephen we're not, and I'm slipping it in every single chance I have. I'm sorry, Stephen.
It's hard not to, isn't it?
It is hard not to.
But bundles in. I mean, if it works in for it.
Yeah. Well,
where are we as a state, Christian, with our legislators for and against? Do you know?
As far as Medicare, Medicare for all. Well, I think almost. If they're Democrats, almost all of them are for Medicaid expansion.
I mean, that's Medicare fraud.
Medicare for all.
For all.
Oh, Medicare for all. However,
I could make a joke, but I won't.
Yeah. I do believe that almost every elected official from the Mecklenburg County area supports a national Medicare for all system, except I believe Jeff Jackson. That's the only person who does not support it. But I believe everyone else supports it. And I thought it was very wise for the
When you
Medicare
say
for all.
Jeff Jackson doesn't support it, has he given another idea of what other options we should have besides Medicare for all?
I don't know, but I thought it was very, really smart for the healthcare advocates in this area to start to ask those questions from local, county, and state elected officials. So that way, when they decide to run for a federal office, not only do we have them on the record, but also they understand how important that is to win a segment of the population that they need to win just the primary. So I do think, so that's where that stands. But the last question I have, because we could talk, I'm sure we could talk about this for a lot, and I'm not even sure if we helped anyone make the decision between Medicare and Medicare Advantage. We've got a lot of information.
Well, the only thing they need to hear is no Medicare Advantage.
Okay.
That will help
Okay,
them,
all right,
and it
well,
will help the country.
Well, that's not
There
a
you
good
go.
choice.
Yeah. Well, the question I have is, during COVID-19, that is really what my biggest concern is for these seniors who have either Medicare or Medicare Advantage. If you have Medicare Advantage, you have to go to a specific network of doctors, specialists, and hospitals. So if you get COVID, and we do know that, I forgot what the numbers that came out, that people over 55 years old are the highest percentage of fatalities in America. There may be some that may be limited to the type of specialist they can go to, or I'm confused about that, especially if they're traveling and they catch it.
Okay, well, the bottom line is if you get COVID and you need to go to a hospital and go on an ICU on a ventilator, you're not making any healthcare decisions yourself. You are being taken care of. And then it might turn out that your Medicare Advantage plan might have included that hospital, but by golly, maybe it didn't include that specialist who took care of you in the ICU. Maybe he was out of your network. So you're going to get home and you're going to suddenly get this big fat bill. And again, as I said, Medicare Advantage plans have a cap on the out-of-pocket expenditure, so maybe your bill will only be $7,000 that you hadn't expected. But you know who pays the rest of that bill? All the rest of us. All the rest of us. So you're basically kind of screwing your fellow Americans by adding more profit to the private insurance companies. You know.
The idea that specialists at hospitals would even be out of network to begin with seems ridiculous to me.
Well, if you want to make a list of things that are ridiculous, man, sit down and grab a cup of coffee. Yeah, that is ridiculous, isn't it?
Or,
but hey,
or an
that's
entire
freedom,
carafe.
that's freedom of choice, isn't it? Isn't that everyone's freedom to opt in or out? And doctors can't be mandated to adopt certain kind of plan. Now, some hospitals say if you want to be on staff here, you have to agree to accept all insurance, but a lot of them don't. A lot of hospitals have contracts to staff their emergency room. And so the hospital says, fine, you're going to staff my emergency room. I'm not going to ask any questions. And then that company that has a stable of ER doctors, they don't give a flip kind of who's in which insurance company or not. They've got their own little deal. And so the problem comes when the patient gets a surprise bill. So no, it's one of many scandals in the healthcare system.
I've heard that some of my friends we were talking about it over the weekend about Medicare and all that. Some are very concerned about how we can't change our plans once we're into it. We got to wait till next year. But what happens when we get a letter say, oh, your Medicare or your plan doesn't cover us because we switched to something else, or your doctor's no longer in that network? How?
That might be an exception depending on what plan you have. There are exceptions and you need to know what they are if you're going with an advantage.
But why do you need to know what they are?
I know, but most people don't know that. But
exactly.
If you're
it's kind of like every time you download new software, how many read that 20-page user agreement?
It's like my
How
doctor.
many?
My doctor, she's no longer, and I mean, they let us know
Yeah.
what a week before. She's no longer in our network, so she's not my doctor anymore. And she knew my thing, so now I have to start. I feel like I have to start all over again with my new doctor because
Yeah.
Yep.
this is crazy.
Well, I hope this show has educated people on Medicare and Medicare
Oh,
Advantage.
it made them more confused.
It does sound like it's not as easy as, I mean, just from a logical standpoint, I'm watching all of these commercials and I keep saying, my gosh, there must be so much, they must have so much budget in marketing. And if they have that big of a budget in marketing, they must be making some kind of profit somehow, and because they don't just do it for free. And that
lab work in Valentine. It's versus lab work in university.
Yeah. Speaking of that,
let me just kind of throw out one last little number, and that's called the medical loss ratio. But for simple terms, there is kind of a law that these Medicare Advantage plans have to spend a certain amount of their income on patient care.
Yep.
And I think the law is only about 85%. That means they can spend 15% on executive salaries, advertising, marketing, whatever. So even no matter how you slice and dice it, some people say that the administrative overhead of Medicare Advantage plans, these for-profit plans, is like 8 to 12%. Medicare, regular, good old government-run Medicare, their administrative overhead is probably 2 to 3%. So there's the difference. Medicare spends 98 cents of every dollar paying for your health care, and the private ones spend 85 to 90 cents. So there's
so if you want to work in the industry, you want to work for the
poor.
advantage system, right?
Oh, totally. Well, unless you're honorable and you're trying to kind of help the country, then you want to work for a regular Medicare.
Hey,
so that means, Dr. B, so that means that, some of these families, they have to be extremely 100 plus poor range to be able to take advantage of the Medicare or Medicaid.
No, that Medicaid.
Did you say in the poor range, like poverty?
Yes.
No,
okay, that gets you on the Medicaid.
Okay.
It's the one with poverty. Yeah, Medicare doesn't have an income level.
Gotcha.
I mean, Warren Buffett's probably on Medicare.
Gotcha.
So what
age 65 and you're automatically enrolled. Medicaid is, I call them state-run systems, and it has to do with your income.
Gotcha.
Right.
But you can be a Medicare patient and have Medicaid because of your income in that state. You can be Medicaid.
So what Mama Ruth, the question you asked, Mama Ruth, because we've had this whole show, that is exactly what most people are confused. Medicare, Medicaid, two completely different things.
Right.
They sound similar, but they're different. Medicare Advantage, all of these terms for working class people who are going to work and getting their kids from school and having to help their senior in-laws or whatever. It is confusing. And this will lead us to our show that we're going to have at some time, why we could get rid of all of this if we just got Medicare for all. So on that, sorry, Stephen.
No, it's okay. Hey, actually, I have some information you asked earlier about Medicaid expansion in North Carolina.
Yes.
Hold on one second. So the Republican Party has, hold on, let me turn my camera back on. So the Republican Party has a 65-55 advantage in the North Carolina State House and a 29 to 21 advantage in the North Carolina Senate. So, and I think it would be reasonable to presume that the overwhelming majority of Republican Party members do not support Medicaid expansion, and the overwhelming majority of Democratic Party members do support Medicaid expansion. So it's and that's probably only going to get worse after the redistricting, after the census, seeing as how the Republicans control both the House and the Senate. Yeah. And that is in North Carolina a largely legislative rule that the executive branch has very little oversight on.
Yeah, I mean, and when, we'll see what happens. I mean, who knows? I mean, they can only slice up these gerrymandered districts so much. Eventually, you're going to get black and brown people in every district and progressives. I mean, and quite honestly, poor white people need Medicaid Advantage as well in the rural areas. And my understanding is there was some negotiation from some of the legislators from the rural areas that are mainly white that want to expand Medicaid in North Carolina because of the hospitals that are being closed. So I don't know. I'm a half glass full kind of person. That's why I drink beer, because you don't need anything if you drink beer. And it, okay, that's a joke. That's a joke.
Christian, I like your philosophy. It's good. It's liquid bread. It's nourishing. It's relaxing.
Yes. If it was good enough for the monks, it's good enough for all of us. Okay.
Yeah, those monks weren't messing around.
We have gone over, and I apologize because we do value your time. If you're on this call, please stay on so we can do our promo, and I can thank you personally. We're going to go around the Brady Bunch screen so you can tell us where you're going to be over the next week. I believe it is Stephen, Baby Trump Pinata, Dr. B, Barb, and Mamma Ruth. And just in case you're wondering, Baby Trump Pinata has 2 Virgin Mary candles that he's burning until his uncle Trump concedes. So he is burning the midnight oil, waiting for his and.
I hope those are long-acting candles.
I was gonna say,
Oh, yeah.
you better buy
Yeah,
the,
I don't think he'll ever
battery-powered
concede.
candles.
He'll
So-
just leave one day.
This is his cousin who was. He's full of candy. He's waiting to be broken as soon as Trump concedes.
January
And Dr.
20th?
We'll find out. And Dr. B, I don't
Ooh,
know if
that
you
could be
popped the
fun.
champagne open. Did you ever pop your champagne open?
No, well, I considered it, but things were drawn out so much it was kind of hard to celebrate. And then we McConnell's still going to be running the Senate,
Yes.
and so it was just not a celebratory occasion. So I took it back out of the refrigerator, and I'm going to wait till January 20th until the evil witch really is kind of out of the house.
Kind of gone. Hey,
Okay.
before we leave, Cindy,
Yes.
Cindy down in Texas. Hi, Cindy. Thank you for watching. She's letting us know. She's giving an advice saying, seniors, be careful because they will be getting mail thinking that it's from Medicare, Medicaid, but it's from agencies not part of the assisted programs. So that's kind of a fraud alert that y'all got to be careful.
Okay, so let's go around the Brady Bunch screen. Stephen, Dr. B, Barb, and Mama Ruth, and tell us where you're going to be.
This week, I'm just going to be hanging out, doing my thing. Phase 3 lockdown still in place, so it's not like I'm going to be going out to bars and stuff. So it is what it is. I will later today, though. I'm going to a community event hosted by an organization called Black Guns Matter. It's a maybe not something many of your audience would enjoy, but it is a Second Amendment self-actualization program targeted specifically toward Black and minority communities, very much in the vein of the old school Black Panther Party. And it's something that I rather like. And the guy who heads it, a fellow by the name of Maj Touré, is someone I've met in the past and a man I find quite inspiring. So I'll be doing that later today up in the Camp North End area, and I'm looking forward to it.
That's fantastic, Stephen. I hope you will wear your Black Lives Matter T-shirt when you go to that event, and kind of show your support. I'll be mainly doing phone banks in the Georgia Senate runoff to try to get the Democrats elected in Georgia, which would give Democrats control of the United States Senate. So I'm shifting my phone bank and texting activities from here in North Carolina. Now it's essentially settled to trying to help out in Georgia, and otherwise continue to educate myself on systemic racism.
Dr. B, did you find phone banking productive?
I tell you, it's it's kind of like fishing. It's a whole lot of boredom and then a whole lot of excitement all at once. I mean, you do 29 calls where you have to sit there and listen to, leave your voice message, blah, 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 and you leave a voice message. And then you get somebody who kind of says, I didn't know, how can I make it work? Well, here's the number of your board of election. And so you really can save a few votes, and that's very rewarding. Okay. Even kind of less aggravating is texting, because you're just, sitting there sending out messages and responding to replies, not sitting there having to listen to voice messages all the time. But no, it takes a lot of patience, but I think it's well worth it.
Okay, because that's one of the things on my list. I've been called by somebody to help do that, and I'm like, okay, I'm
Do
gonna
it.
ask Dr. B. So
Yeah.
I'm looking into it. And
Yeah,
then
and even the most effective, they tell me, is the actual door-to-door canvassing, because a lot of people don't answer their phone, they don't respond to text, they don't respond to email. We just can't find these people whose votes are sitting there in a box in the Board of Election, not being counted because they messed up the signature. And so to actually knock on doors and contact these people is very rewarding, but I can't do that because of my age.
Right.
But for younger people that feel comfortable doing that, and it's socially distanced, but the
And
reports
Barb, you
I've
should
heard from
totally
people out in
phone
the field-
bake for Purdue because he needs your help.
for who?
I said, Barb, you should definitely phone bank for Purdue because he needs your help.
Oh, I trust that's a joke. Yeah.
Okay,
Yeah.
Barbara, where are you going to be?
I'm going to be here locally. I've got two seniors that I'm helping with their Medicare, and I'm trying to switch them back to Medicare because they would be in what I would call the catastrophic price range, and they need to get off Medicare Advantage. So I do support regular Medicare, especially for sick elderly people. They just don't understand it. So, and then guess what? My front lawn got fixed.
Oh, wow.
Success.
It's raining and I'm gonna go out there and beat
I
up.
thought you were gonna wait until January 20th.
Well, yeah, I could do that too, yeah. That's what
Okay. Stephen?
No,
He
Mama Ruth.
said Mama Ruth.
Oh, Mama Ruth, I'm sorry.
I'll be here at home. I'm still dealing with this cold. I don't want to go out anywhere. Just be here. So, y'all have a great one.
And Dr. B, I was joking about the Purdue thing. My my guy was Shane Hazel, so
Christian, what are you gonna do? Oh,
Yeah,
you're
we can't
muted.
hear you,
You're
Christian.
muted, you're muted.
Yeah, you're muted. You
Yeah,
muted
there we
yourself.
go. Sorry about that.
There you are.
I will be here. I'm hoping to go down to Georgia the last week of after Christmas to help out for both of those elections. And otherwise, I'm just so grateful that everyone made the decision to vote. As we had the most voters in American history, I believe, since in 120 years. I don't remember the data. And so regardless of who you voted for, just remember that it was great to see so many people come out to vote. And that is a wonderful thing, which leads us to next week's show. We hope to have people who possibly did not vote for Biden-Harris or whoever you voted for. And we want to talk about how we come together as a country, if we even can, close to come together as a country after this election, because, we do have other issues that we need to focus on as Americans as well. And so I do want to thank everyone for joining us. Please stay on Zoom so we can make the promotion, and I can thank you personally. Anybody else have anything to say before we hang up? Nope. Good.
Peace.
No jokes, Stephen?
I'm trying to keep my powder dry.
Yes. Just to let you know, Dr. Cohen, who is Stephen's favorite person, and our North Carolina governor and Department of Health, they have issued guidance for Thanksgiving and Black Friday. Very interesting. Go to the website, click on the guidance, if you're considering celebrating Thanksgiving with the family, what to do Black Friday. The safest way is to do it virtually. That obviously is the safest way. But if you just must, there are some really good suggestions. We are going to visit our family in Tampa, so we're getting our COVID-19 test 3 days before we travel, and then we're also getting it when we come back as well. And we're having just a few people outdoors, all wearing masks. Probably going to have to sneak a turkey leg under the mask. We'll figure all that out. I'm still trying to invent the mask with the straw in for the beer. I don't know how we're going to do that, but please follow guidance. And
I've seen masks with zippers.
Yes.
Oh,
Yes.
I've seen one with a fish bowl in New York. It was like a big fish bowl.
So Jenny James Gunn wanted to invent the mask that had the beer one.
Yeah.
that goes-
Yeah. From the
And
helmet
I don't know-
down in. Oh,
And I don't know if the bartender's supposed to pour the beer in I don't know. That was really complicated. So we'll find out. So please be safe if you decide to do Thanksgiving. But remember, I think you'd be more thankful to have the family member alive next year than you would anyway, putting each other in danger.
And I will say, as much as I have differences of opinion with the head of the Department of Health and Human Services and the governor's office, they have done a very good job of putting out the information and their advisories and things like that. So the government website, the department, DHHS.gov or whatever it is, you just type in North Carolina Department of Health and Human Services in Google, it'll come up, and it's really easy to navigate, and they have all their information there. Whether you agree with it or not, the information is at least there, which is one thing that North Carolina does do well versus other states.
Thank you, Stephen. That was.
I like to give credit where credit is due.
That's good. All right.
I'm not some dirty anarchist.
Bye, y'all. We'll see you next week in Coffee and Ponduce.
Bye.